Pelvic health physiotherapy is an area of physiotherapy which focuses on the pelvis, and this can include symptoms such as incontinence, prolapse. It can be for men and for women. It can be due to pain or sexual dysfunction, and we are the ones responsible for taking care of women in their pregnancy and postnatal recovery. So as pelvic health physios, we treat for, predominantly incontinence is why patients will come to us, but also pelvic organ prolapse, sexual dysfunction, general pelvic pain that can be caused from conditions such as endometriosis or adenomyosis, and also taking care of the pregnant woman. Surprisingly, a lot of patients who may not even feel their symptoms are due to pelvic floor dysfunction. Patients who had long-standing hip problems often have an area within their pelvic floor that is contributing to their pain. So if you've been having a lot of hip problems and done a lot of physio or other treatments that just aren't quite nailing it, sometimes pelvic health physios can find some pelvic floor dysfunction, which is a key contributor. Anyone with incontinence, both bladder and bowel, both male and women, and also as pregnant women. And the really helpful thing to remember for pregnancy is it's 9 months to grow a baby and 9 months to recover, and as pelvic health physios we can help look after you throughout that entire 18-month journey. So pelvic health physios have a little bit longer with their patients than you would expect in a normal musculoskeletal appointment. We'll take about an hour with you. In that hour, we will take a very lengthy subjective history. We'll ask lots of questions. Some may feel a bit personal. You'll wonder why they're relevant, but all of them allow us to build a picture of what's going on. We'll ask questions about your bladder, about your bowel control. We'll ask about sexual dysfunction and general aches and pains. If you're a woman, we'll ask about your gynecology and obstetric history. After we've taken that long history, which is taken in a private room and no one can overhear anything we're talking about, we then will proceed to the examination. And this is usually the part people are most worried about, and whether we do internal exams. We do internal examinations. We may, depending on your symptoms, start with an external examination of your pelvis and hips, and then we'll do the internal exam. That's done again in a room with a lock. No one's going to wander in the middle of it. We will talk you through it. We'll explain everything that we're going to do. We will examine externally first, and then we'll just use a finger to examine the pelvic floor through the vagina or rectum, depending on what your symptoms suggest is the main problem. We will use nitrile gloves, so no latex is used in the department, and we'll use a very gentle lubricating gel just to make it as comfortable as possible. The important thing to understand about an internal exam is that you are in control all the time. You offer your consent and you're free to withdraw it. We will watch your face closely to see if we hit any areas of pain, any areas that appear to be more problematic, and we'll be gentle throughout all of it and go nice and slowly. But the important thing to remember is that you really are in control, and you can ask us to stop at any point in time. You can absolutely see a pelvic health physio during pregnancy, and we would encourage you to come and see us really as early as possible. The main reasons patients come to see us during pregnancy is because of pelvic girdle pain, which is any pain really throughout your pelvis, kind of from your belly button down towards kind of halfway through between your thighs. Any of that pain there, aches and pains, can be attributed to pelvic girdle pain, and we can encourage you and most importantly educate you on how to prevent it getting worse. If you have any concerns about pelvic floor dysfunction, and often problems will occur maybe in the second pregnancy as the weight of the baby starts to take its toll on the pelvic floor, you may find that you're struggling then with some symptoms of incontinence, and we can help with all of those. We can do internal exams when you're pregnant. We wouldn't normally do them before 12 weeks till you've had the dating scan and cleared that everything's fine, and we don't tend to do them after 36 weeks because we don't really want any babies delivered in our department. Thank you very much. But yeah, you can come and see us when you're pregnant, and we'll support you all the way through your pregnancy. For women coming to see us postnatally, we usually suggest coming to see us after about 6 weeks. Historically, that's because by then you'll have most likely seen your GP, but there are problems with some women getting GP appointments at 6 weeks, so you're free to come and see us before then. I wouldn't suggest you come and see us before 4 weeks, simply because the tissue needs time to recover, and that is the normal window for the tissue to recover. So we don't want to be diagnosing anything when it might just be that your body's just got to do a little bit more recovering. But you can come and see us after 6 weeks, and we do encourage you at 6 weeks, and then we have a package that allows you to see us 6 weeks and 3 months, and we can see you more if we need to. You don't need a referral to come and see pelvic health physiotherapy. The research data is really quite clear on incontinence, particularly stress incontinence. Working with a pelvic health physiotherapist can reduce symptoms in 80% of women, which means they will not need any further treatment. And that doesn't require a GP to come and see us. We do suggest when you come to see us, you bring us a list of all your medication and any concerns you have. Write down any questions, because invariably, even as healthcare professionals, we forget questions we want to ask when we get in front of another healthcare professional. But just come and see us, make an appointment, and we can start working with you today. Pelvic health physios are passionate about what we do. It's not known as the glamorous side of physiotherapy, but it is a crucial aspect of physio that can affect your self-confidence and your ability to live your life. Here at Move Forward, we offer numerous packages for you to come and see us. We are proud of the service we offer. We are compassionate and passionate about getting you better. So please don't live in fear or live with symptoms that don't need to be part of your normal life. And we're happy to help you.